Hello, professionals. My name is Donna Edwards, and I'm going to be providing you with some continuing education units so that you can continue to work in your profession with some enhanced knowledge. I am a certified addiction treatment counselor 4 who is accredited by the Addiction Counselor Certification Board of California. I have worked in this profession for over 20 years. I am a CEU provider approved by CADIE, California Addiction and Drug Educators. Ethics is only one part of the story. Every story has a beginning. The other part is how we get lost along the way. Once upon a time, we were innocent, naive, whole, trusting. And then we were transformed. Psychosocial factors include abuse, family life as a child, sibling position, bereavement, mental illness, addiction, others and self, physical health, others and self, social, experiencing a traumatic event or witnessing a trauma or death. Internal family systems theory. Robert C. Schwartz. Our disturbing thoughts and emotions are manifestations of inner personalities that have been forced into extreme roles by traumatic events in our lives and represent the underdeveloped protective parts of ourselves. Basic premise is that we have an inner family of parts that live within us that protects us and those we love from danger. The parts, the journey of wounded clinician, unusual circumstances involving birth or upbringing, traumatic event that leads to change in life forever. Special gifts develops. Provides supernatural help. Proves worth as a healer. Journey an unhealable wound sustained during the trauma. Atonement with others who hurt them or family. Apotheosis, this is where the hero is revealed. Marcia Lehan, 3 stages of the mind. There is the reasonable mind, emotional mind, and the wise mind. The birth of the wounded healer. Wounded healer concept. Personality characteristics of the archetype of healer. The motto, love your neighbor as yourself. The core desire to protect and care for others. The goal to help others. The greatest fear is selfishness and ingratitude. The strategy is doing for others. The weakness is martyrdom. The talents are compassion and generosity. The brand is people pleasing. The relationship style is highly agreeable and accommodating. Worst fears of healers: to harm others, to disappoint, to become what people say I am, being abandoned, being rejected, not believed in, not supported or connected. Two types of ethics: the personal code of ethics and the professional code of ethics. If you have your ethics and I have mine, personal ethics, the unspoken oath. To heal others no matter what. To sacrifice yourself for the greater good. To be there for the sake of others. To use gifts to help others. To never give up on others even when everyone else has thrown up their hands. Professional ethics. Ethic investigates the questions: what is the best way for the clinicians to practice? What actions are right or wrong in particular circumstances with clients and paperwork? Serve to resolve the questions of human morality. The functions of professional ethics is to protect clients from harm, set forth the ethical obligation and role of counselors within the counselor setting, creates standards regarding the role, responsibility, and conduct of the professional counselors, identifies ethical considerations relevant to the professional counselor and trainee, identifies the nature of the counselor's responsibilities, helps counselor design with the client a plan and expectation of the counselor and the therapeutic process, defines the limitations of the client-counselor relationship, serves as the basis for processing inquiries and complaints. Major areas of ethics study: normative ethics, known as moral theory, concerning the practical means of determining a moral course of action. In essence, it is focused on if it is morally okay to hold onto I set up beliefs. It investigates the set of questions that arise when considering how one ought to act morally. It examines the standards for the rightness and wrongness of actions. Applied ethics. It's concerning what a person is obligated to do in a specific situation or a particular domain of action. Ethics. Consequentialism. It is the consequence of the action. The end justifies the end. Alternatism. It is the ethical theory that argues the proper course of action. Personal ethics and development of a substance abuse counselor versus other mental health professionals. Substance abuse counselor in the field because life showed up and they learned how to cope, not to cope. Direct experience with an addict. Giving back to others is a way to pay past help forward. The ethics is helping by any means necessary. Job is not done until addict is clean, recovered. The behavior is always available. Mental health providers, interested in the field because of fascination with helping people and human behavior, likes helping people. The ethics are governed by code of ethics. Behaviors sometimes available. Counselor Code of Ethics. Professional competence versus ethical responsibility. Code of Ethics for Professional Counselors. Professional competence. Ethical responsibility. Counseling relationship. Here's a cartoon illustration that states, "Turns out I'm addicted to therapy. Now what?" Ethics. Counseling relationship. Fees and bartender. Ethics. Records and confidentiality. Informed consent. Sexual misconduct. Here's another cartoon illustration that states, "He first saw her in an alley, her gentle curves inspiring him to climb from the gutter." Ethics, sexual misconduct, physical misconduct. Common ethical sanctions. Here's a cartoon illustration that states, "People are always telling me to look in the mirror. What's with that?" Ethical violations. Dual relationships with patients. Sexual misconduct with a client. Patient abandonment and failure to terminate properly. Use of drugs and alcohol with patients. Commits an act of immoral or unprofessional conduct in the practice of clinical or non-clinical counseling or therapy. Engages in an act of unprofessional conduct in the practice of clinical or non-clinical counseling or therapy. The breach in confidentiality. Excessive billing. Poor record keeping. Makes a willful misrepresentation while counseling or providing therapy. Practicing with an expired license or certificate. Practicing without proper credentials or license. Use of power to coerce or exploit clients. Factors that contribute to clinician acting outside of ethics. Patient-provider relationship. Vicarious re-traumatization. Transference or countertransference. Life changes, aging issues, death, etc. Job stressors. Medical issues. Financial stressors. Compulsive caretaking. Community pressure. Manifestations of symptoms. Boundary violations. Dual relationships with clients. Addiction, mental illness. Therapist distress and burnout syndrome. Compassion fatigue. Arrest and patient complaints of ethical violations. Strategies for preventing ethical violations. There is hope. Enhance self-connection awareness. Know your code of ethics. If you are not sure, call the licensing board. Consult with a supervisor. Ask yourself, what part of me is making the decision? Am I operating out wise mind versus emotional mind? What am I afraid will happen if I am not perfect? Why am I afraid? What am I afraid will happen if I say or disappoint others? Am I in a therapeutic role or hysterical role? Are you operating out of personal code or licensing ethics? Make the unconscious conscious in order to reduce emotional blind spots. Reconstruct persona of a good enough therapist based on ethics, core values, and Hippocrates' oath. Create life balance and self-care. Increase their ability to function within their scope of practice. Creating healthy coping mechanisms. Create outlets for self-expression. Don't multitask. Set out community support away from clients. Delay responses by urge surfing and observing facts. Make decision to be present for your most wounded part of self. Today, I will live in the moment, unless the moment is unpleasant, in which case I will eat a cookie. Decrease emotional reactivity meditation and grounding techniques. Meditation is a way to help the clinician to turn the focus back on the internal emotional process and regulate mood. Grounding process that helps the body to stay present. Basically, it consists of a set of tools, skills to help you manage, disassociate, and the overwhelming trauma-related emotions that lead to it. Thank you for watching the video. Next, you'll be taking a quiz. Once you pass, you'll receive a certificate of completion with your CEUs that you have earned. My valid provider number will be on your certificate to turn in to your certifying body.